Good day, magandang araw po. Ako po si Dr. Bian Matawaran. I'm an endocrinologist, a specialist po sa hormones at internal medicine, and I will talk to you about why do we screen for metabolic syndrome in psoriasis. So una po nating tatalakayin kung ano ang tinatawag nating metabolic syndrome. So basically, metabolic syndrome po ay kilala sa iba't ibang pangalan. So ito ay also kilala sa tinatawag na insulin resistant syndrome, metabolic vascular syndrome, the deadly quartet, dysmetabolic syndrome, or syndrome X. So ang definition po ito ay nagka-characterize lang, okay, by representing a constellation of risk factors for cardiovascular disease. So anytime na tayo ay merong tinatawag na metabolic syndrome, lumalaki ang tsansa or ang risk natin na magkaroon ng mga sakit sa puso, na stroke, heart attack, at even diabetes mellitus. There are several organizations giving us definitions on metabolic syndrome, kagaya po ng WHO or World Health Organization, ang AACE, the American Association of Clinical Endocrinologists, the European Group for Insulin Resistance, the National Cholesterol Education Program Adult Treatment Panel 3, and the IDF or International Diabetes Federation. So makikita po dito sa ating mga definition ang insulin resistance, adiposity index, lipids, blood pressure, at sugar. So para po mapasimple, para po sa ating po na nakikinig sa ngayon, basically this cluster of health syndromes, conditions contain visceral obesity or ang pagtaba, hypertension or alta presyon, insulin resistance, pagtaas ng blood sugar, o tinatawag nating pre-diabetes at diabetes, at abnormality sa tinatawag nating cholesterol or lipid profile. Isa-isa po natin itong mga kondisyon. So number one, visceral obesity or pagtaba. Paano po ba natin malalaman kung tayo ay mataba? Okay? So a very objective parameter is to measure what we call the body mass index or BMI. Ito po ang measure to determine obesity. So pareho po ang cut-off numbers that you will see here in the picture on the right for both men and women, and this correlates with body fat. So it will also determine the degree of obesity and health risk, and can be used as well to treat, to follow up or track results of treatment for those being given medications for obesity. Okay, it may be inaccurate, unfortunately, for those patients who had edema. It may overestimate body fat dun po sa very muscular, or underestimate in those older people with who lost muscle mass. So paano po malalaman? Tandaan po ang formula. Weight in kilograms divided by height in meters squared. In meters squared. You can see po in this formula. Know that if your values are between 18.5 to 23, so this is based on the on the Western Pacific Region International Obesity Task Force. This is applicable for Asians, just like the Filipinos, versus the ones on the left, which is the WHO or World Health Organization applicable for Caucasians. You will see that anytime that your BMI is more than 23, you are already overweight or obese if more than 25 per kilogram meter squared. So bakit po importanteng malaman natin ang BMI natin? Because it has a direct relationship with mortality or mga sakit or even pagkamatay. So as you can see po, for those patients with low with 25 to 30 BMI, habang tumataas po yung BMI for both men and women, tumataas po yung risk for mortality or mortality rate. At pinakamababa siya sa mga may pasyenteng BMI ay between 20 to 25, which is normal. So another way of looking at obesity or identifying if you're obese or not is to look at the body type. Pero po tinatawag tayong apple shape or pear shape. So pear shape, as you can see on the picture on the right, is basically a person who has bigger hips, not bigger hips po, versus pear shape where in the abdominal area, yung sa tiyan po ang malaki. At dito po, ang pear shape ay nakalalamang because dito mas mababa yung tinatawag nating risk for cardiovascular disease. Mataas ang subcutaneous fat, pero ang intra-abdominal fat, which is the fat that is responsible for heart attack and stroke, ay mas mababa. So it's better to be a pear than to be an apple with regards to body type. So also a measure in identifying body types is what we call the waist circumference. So it measures your excess abdominal fat, which also predicts health risk. So dito po ang tamang pagkuha ng weight, hindi doon, waist circumference, hindi doon po sa pusod. Para po hindi na mabago, doon sa upper segment or upper area of the iliac spine. Ito po yung buto natin sa hips. So it independently predicts health risks when BMI is not markedly increased. And sabi po natin, it is also used in the diagnosis of metabolic syndrome. So unlike BMI, meron pong cut-off for men and women at again, depende po sa race. So for example, sa atin, kapag more than 35 inches sa lalaki or more than 31 inches sa babae, meron tayong tinatawag na abdominal obesity or increase ng ating tinatawag na waist circumference. Dito po sa picture na ito, pinapakita kung ano po ang ibig sabihin kapag mataas ang subcutaneous fat at mababa ang intra-abdominal fat. So ito po yung sinabi natin pear shape. So ang intra-abdominal fat, sabi natin, ang siyang nagkukos ng mga heart attack and stroke. So ang mga pasyenteng mababang intra-abdominal fat, mataas ang subcutaneous fat, meron pong basically normal metabolic profile, no metabolic syndrome, at mababa yung risk for cardiovascular disease. Versus someone na mataas ang intra-abdominal fat, mababa ang subcutaneous fat, meron pong mga alteration sa cholesterol, glucose, or what we call metabolic syndrome. At ito pong mga pasyenteng to ay mataas ang risk for cardiovascular disease. In addition to that, depending po on the race or ethnicity, kung ikukumpara natin po ang atin, Asian, intra-abdominal versus subcutaneous fat, mas mababa yung subcutaneous fat versus our intra-abdominal fat compared to Caucasians and Blacks. However, ganito po ay mas mataas ang cardiovascular risk. Okay? So aside from visceral obesity, part po ng metabolic syndrome ay hypertension, pagtaas ng blood pressure. So either po meron tayong tinatawag na grade 1 or grade 2 hypertension. Pag sinabi po natin grade 1, 140 to 159 over 90 to 99 ang ating blood pressure. Kapag po grade 2, kung ang systolic blood pressure natin ay 160 over more than 100. At ang pag-start po ng gamot ay depende sa tinatawag nating heat map. Kapag po tayo ay pumalo doon sa area na kulay pula, high risk tayo, kailangan na nating maggamot para sa blood pressure. Lalong-lalo na kung ikaw ay meron tinatawag na HMOD or hypertension modified organ damage. So ito po yung may malalaking puso, no, meron peripheral arterial occlusive disease, yung po meron tinatawag na CKD or pagkasira ng kidney. Kailangan na po tayong magbigay ng gamot. Kung tayo po ay merong diabetes or tayo ay na-stroke or na-heart attack, kailangan po ng gamot for blood pressure. Ngayon po ay hinihimok natin na magkuha ng blood pressure sa bahay. At meron po mga available na digital sphygmomanometer or blood pressure monitoring na pwede nyo pong gamitin at malaman po ano po yung appropriate or nararapat na blood pressure target para po sa inyo. Kung meron po kayong may mga blood pressure machine, pwede nyo pong tingnan sa website na stridebp.org at i-enter po kung ano po yung tatak ng blood pressure machine nyo para malaman kung ito po ay validated by the European Society of Hypertension and the International Society of Hypertension. So insulin resistance ay basically po pag-check ng ating mga blood sugar. So tayo po ay tinatawag na diabetic kung mataas ang tinatawag nating fasting plasma glucose or yung HbA1c, which is the average blood sugar for the past 3 months. Pwede rin po tayong magpa-OGTT at kapag po yung mga numero na ito ay mataas doon sa mga test na pinagawa, then tayo ay merong diabetes mellitus. Kumpara po doon sa mga normal values. However, para po parte ng metabolic syndrome, hindi kinakailangan diabetic kahit po ikaw ay tinatawag nating pre-diabetic lamang, meaning mataas sa normal ang blood sugar pero mababa sa diabetes. Ito po ay isang component pa din ng metabolic syndrome. Okay? Huli ay ang mataas na triglyceride at mababang HDL cholesterol. Ano po ba ito? So alam natin na ang cholesterol ay isang substance na siyang kumakabit sa ating mga ugat, kaya po kumikipot ang daanan ng ugat. At kapag kumipot ang daanan ng dugo sa ating mga ugat, ito po ay risk na magkaroon ka ng heart attack at stroke. Okay? Ang cholesterol po ay meron tinatawag tayong high-density lipoprotein or HDL cholesterol at meron pong LDL cholesterol or low-density lipoprotein. Ang high-density ay tinatawag natin good cholesterol at low-density ay bad cholesterol. Pag po tayo nagpa-test, ng blood test tayo, meron tayong tinatawag na lipid profile. So makikita po natin itong mga resulta nito. Bad cholesterol, LDL, HDL, good cholesterol, triglyceride. Sa mga pasyente pong may metabolic syndrome, mataas ang kanilang bad cholesterol, mababa ang kanilang good cholesterol, at mataas din ang kanilang triglyceride, all of which contribute to cardiovascular disease. Ito po ay importante nating malaman because nakita po natin na ang mga pasyenteng may psoriasis ay usually obese, may hypertension, may diabetes, pangit at cholesterol, at merong non-alcoholic fatty liver that will be discussed later by our next speaker. So makikita po natin na overlapping ang manifestation ng psoriasis at metabolic syndrome. At meron pong mga postulated mechanisms kung bakit nakikita natin ang dalawang kondisyon nito side by side. Because these two conditions are pro-inflammatory conditions. There is oxidative stress. There is abnormality in adipocyte hormones at gut microbiome. So makikita po natin sa mga picture na ito po ang mga skin manifestations ng psoriasis, pero makikita po natin yung tinatawag natin characteristic na metabolic syndrome or obesity sa mga pasyenteng merong psoriasis. At based on the body mass index and their triglyceride level, their HDL level, their blood pressure level, and the presence of diabetes and high glucose, you will see that the risk for having psoriasis and metabolic syndrome increases with all of these values, as much as 30%, even for those BMI of less than 25 kilograms. And this is consistently elevated with the presence of these other characteristics. Bakit po kailangan natin itong malaman? Kasi po, mayroong mga gamot na binibigay tayo sa mga may metabolic syndrome like methotrexate or cyclosporine that can actually worsen the components of the metabolic syndrome. Papangit po yung mga cholesterol, pwede pong tumaas ang blood pressure, pwede pong tumaas ang blood sugar kapag nagbigay ng cyclosporine sa mga pasyente na mayroong metabolic syndrome. And of course, sa huli, kailangan din po natin gamutin ang metabolic syndrome so that anytime na mataas ang iyong cholesterol, magbigay ka ng gamot for cholesterol. Mataas ang blood pressure, magbigay ng gamot for blood sugar. Mataas ang blood pressure, magbigay ng gamot for hypertension. At kung ikaw obese, i-discuss ang possibility ng pagbibigay ng mga gamot para sa obesity. Pero ang pinaka-importante po para po matulungan natin ang mga pasyenteng may metabolic syndrome ay still at most effective at mas matipid ang tinatawag natin diet. So with that, maraming salamat po. Naway may natutunan kayo sa kaunting lecture on metabolic syndrome. Good day.